would say that.
Actually, most of us have forgotten that there's COVID and yeah.
No, actually, I'm so much in a habit. Actually, I forget that it's people are not wearing. I wear it even then. So, thank you again for the opportunity to be here, and thank you, Dr. Basak and Dr. Rajesh, for chairing the session. And there was a lot happening again. What Dr. Sunita had said before, we were taken aback by COVID, and things have changed definitely. But we all know that iBanking has a long and impressive history, having enabled millions of vision restoring surgeries. And I think 20s have seen a lot of revisiting of iBanking even in the quality level. So it's not all about numbers anymore. And we know traditional iBanking has been like a lot of all the activities being done by the doctors, and it led to a lot of chaos in the iBanks, and it used to be difficult to manage. And now iBanking has changed like the rest of the world. We are no more using rupees, we are all using digital. So what's happening, it's now a professional cadre with most of the iBanking activities taken care by the professionals. When I joined iBanking, it was just the five pillars, but as I have progressed in iBanking, quality and other aspects of iBanking like pre-cut tissue preparation and amniotic membrane processing also became part of it. If you look at this reference model of the iBank, these are the four core activities of any iBank, and how to take it to the next level and how to train becomes important. So, SOPs and training are the key to standardization of any process. And if we have good SOPs and change them and make it a dynamic entity and change it as per the need of the hour, it becomes easy. We have to start training and we have to do the right thing the right way right away. I learned it from Dr. Rao and I really like this equation. And documenting becomes very important in that. So preparation of SOP should be in compliance with regulatory requirements and prepared by focused group rather than people not actually on the field prepare it. It should be by them who are actually at the field, discussed and reviewed by all stakeholders. Yes, we do have two medias currently being used, and again, what I was talking to Dr. Basak, we need to discuss about the availability of these medias also, as this remains the EBI session. Integrated quality program is very important for any iBank. How do we get that? Some is on paper, but if we really have to implement it, it can just be through trainings. And that's where I come back that training of the staff on SOPs and quality documentation practices is very important. Tissue harvesting done by an experienced recovery technician is better than being done by first year residents. We all know that. And trainings again have to be done at level of technicians, be it the technical training, be it their understanding and bringing out the passion in doing that and being more considerate. So a lot of refresher trainings are happening now. Also, again, it has come back, but it was happening in a very high numbers previously. For any iBank, having annual competency assessment makes their recovery program very successful and the utilization rate better. We came up with this rubric for assessment of iBank professionals and iRetrieval as a step to standardize the retrieval process, which was published, and it gives a very objective method of assessing the competency of an iBank technician, and I have heard that a lot of iBanks in India are now following this. So it's a useful training, it has useful to develop training guidelines, identify gaps, and eventually improve retrieval process. The trainer can be an iBank manager, a senior technician, or an ophthalmologist who has experience in retrieval. So it is just not the cornea surgeon who has to spend time, but they can just be trained on how to look at it. So these are the trainings which are happening by EBI, and with a little pace got less because of the COVID. And we also did this comparative study from a US iBank wherein their technicians and our technicians underwent the same workshop, and they found that their steps of problems were a little lens checking over there, and we had more of the conjunctival removal and the irrigation of the cornea were one of the steps which are not being followed very carefully. So incorporating such training modules also improves the utilization rate, but also standardize the entire iBanking process. We need to train the trainers. This was a very effective workshop which happened in 2009 Bangalore EBI conference. And these training workshops, again, recovery technician, has to be taken up by the senior technicians. It has to percolate down the hierarchy of the iBanking, wherein they go there, and these are the residents of KGMU who are being trained by the by the technicians, and I think Anurag can identify from this workshop. So screening and evaluation again are important, and evaluation technician can definitely do much better than the doctors evaluating the tissue. And now most of the eye banks have gone to that level. Apart from that, the workshops with HCRP partners is important, and they are, because they are the ones who have to understand the need. Then motivational trainings for the eye bank staff. They are in a very morbid environment, so they need to be, I mean, again and again motivated that what they are doing has an impact on the better, good for the humanity they are doing. A lot of centers now have pre-cut center facilities, but we need to percolate that training again, and it should go to all the eye banks. So these training procedures, trainings have also happened in the past, and we are also planning it now in the future as well, to do these trainings by experts, and so that the managers or the senior technicians can go back to their eye banks and actually translate. And amniotic membrane, again, a lot of eye banks are doing this, and these courses are also now available. So the aim is to have these, the institutes is to strengthen the training in our country. But then came COVID, and everything which was happening at a very high pace came to a little halt. But the crisis always has some opportunities hidden. We use technology for training now. Virtual meetings, online workshops, distance learning is a new normal now, what we say. But what we found that there was a gap, and there were no formal training centers with short courses available in North India, and there was need to standardize systems of all Indian eye banks to training with implementation of quality protocols, and which will further improve this statistics. So with this aim, we came up with the Jagat Singh Eye Bank Training Academy, and it was inaugurated in the fortnight in 2021. And Jagat Singh ji was eye bank counselor in our eye bank, and he passed away on duty, and he was one of the, I mean, I would say the first counselor, and he brought the eye bank where it is today. So we have a lot to give to him. So, and we named this academy on his, we named it after him, and the aim is to provide world-class training to strengthen eye banking in our country, and to be a partner of choice for eye bankers seeking opportunities to learn new skills or refresh their knowledge. It's a one-stop solution, that's what we say. There are a lot of courses now available, not just here, we have courses in RP Center, in LVP. So I think a lot of choices are there, where region-wise also, where you want to go and increase your knowledge in that. So banking has definitely evolved. There are challenges in India. Around 15% of banking in India is still, banks are still contributing to 80% of the total transplants. But standardization remains the key for further development. We have to use technology for training, and I would say now, post-COVID, this is again time to be, we have to be back at the revolution of banking, which was happening now, and I think it can be back with a bang. We recently did 2 trainings, physical trainings in Jagat Singh Academy from candidates who were from outside India, outside Delhi. So definitely I would like to acknowledge the dedicated eye bank team which we have at our institute, and also the very enthusiastic technicians and evaluators who are actually responsible for training of most of these from the academy. So thank you again for the opportunity, and thank you, sir.
Thank you, Manisha. Wonderful coverage of technology, use of technology. And we have little discussion on media issue. So, Manisha, can you highlight what is the media issue? Recent past. Hey, come, please. Because other thing we can manage, but media.
So now currently, like the cortisol is not available, and I think it's with a lot of eye bankers I spoke, and this is one of the immediate issue which is worrisome, and we are privileged to be in Delhi, and we have RP Center nearby, we can take the help, but I think pan-India, that may not be the situation, and this scarcity will always be increase and increase as it will go down. They are saying right now it's the raw material issue. And what they have mailed us, it is around 4 to 6 weeks it will not be available. But sir, you can highlight on the
No, no,
actual situation.
I want to know about MK Media.
I talked to them in the stall today, yesterday, and they said within 2 weeks there should be no shortage.
Oh, then that's a good news. But even
it's
for
not
the
a raw material. According to them, it's
what
not a
the
raw
mail
material.
we got, an official mail from their side, what we got was 4 to 6 weeks because of some shortage. I have the mail with
Yes,
me,
so-
and that's what it is there. I do not know. I mean that's
Anyway, this is what they said yesterday to me. at the
What
stall.
about MK Media? I'm from Ramayamma.
No, we are talking about
no.
Cornisol.
We are talking about Cornish.
She is talking about Cornisol. And what about MK Media? To temporary. That is. And what about RPC Media? But for our kind of iBanking, we do not get RPC Media. That is one of the problem. The Cornisol problem, sir, it is due to raw material. I have talked with the chief boss,
Okay.
and the problem with CDS, chondroitin sulfate. And probably it will be expensive when they
Bring it
procure.
back.
Because whatever they had earlier,
They finished.
exhausted. And now there are only two sources of CDS across the world. And you know that they are using the best source of CDS, like Viscot. They are using the two sources from shark fin. One source is actually destroyed by nuclear blast in Fukushima. So other source, they are making it higher price because that is the only source available, because they are not using synthetic CDS. They are using the only natural CDS. So that is the problem. Probably it will be available, what Manisha is saying, that maybe after 4-6 weeks, but the stock is not there. It is same with our iBank. So probably we can go. And MK Media, so temporarily I was discussing with her, probably I have to go back to moist chamber method for a few days. Because 2 weeks from your side, 4 weeks from their side, we have only say 10 vial stocks or 15 vial stocks. So it will exhausted within 1 week like that. Yes.
So in this condition, can we use the tissue culture media like Delvecos and other thing? Because we are in a very
You have to talk about practical thing.
yes.
And
Condition where we don't have
tissue culture media, from where you will get it?
no, we can make it at our center. We make Delvecos modified eagles essential media for amniotic preparation.
Oh, no. You are.
Implemented on daily basis, so that would be a very tedious job. The best practical solution would be to just shift their languages.
But LK media is also not there for
Medium is not a problem, it's just a matter of 1 week.
2 to 3 weeks.
To,
In that period, I'm just telling about it.
Only 1 week now.
1 week from now, moist chamber for 1 week.
that is actually the problem is there. Yes.
Again, you know, everything is getting a little delayed. But my problem with the moist chamber, so you're saying our technicians don't even know whole by
I know, but that is probably that will for
EBI will provide videos for full chamber, for full eyeball in English.
Even I need to learn that.
Good old days. We must be having videos.